Hello viewers, welcome to the Lungleng Show. Today joining me is Dr. Joy Narayan Chakraborty. He's a urology specialist working at Apollo Hospital XL, and he has his own clinic known as Guwahati Urology Center, and he has work experience as a surgeon and in urology more than about 30 years. And I think his experience as a doctor will be a lot probably older than many of you, but it's going to be very important to talk about. We'll talk about prostate, and prostate issue and cancer has become a lot of very common issue for a lot of men in men's health problem. So I think understanding it, what is it and how to prevent it, how to take care of it so that people don't get cancer of prostate. And when you have a prostate cancer, it amounts to a life that is, even President Joe Biden, US President or former President Joe Biden has got prostate cancer, and we can see literally how it is affecting his life. So I'm sure this kind of conversation will be helpful for all of us and help us prevent this kind of issue as a man. So we need to talk about this. Thank you, doctor, for joining me in this conversation to talk about this.
Thank you, Lungleng, for calling me.
Yeah. Wonderful. So you have been working as a surgeon and as a urologist for more than about 30 years now.
Yeah.
And when you look back and when you analyze your 30 years experience, and how often did you deal with prostate?
Prostate is such a subject that we need to deal with on daily basis. Daily I need to see 10 or 15 cases of prostate patients, new prostate patients.
Wow.
And most of them come out of sheer ignorance, or they cannot understand what is the initial symptoms and how to approach it. And everybody comes with the hope that we need medicine for prostate, and prostate is a disease. Everybody thinks that prostate is a disease. But I must say one thing.
Then what is
all the male person in the world have got prostate.
I see.
That prostate is a normal gland.
Correct, of course.
Every small child, newborn baby, have a prostate. But prostate is small. As we age, with aging, our prostate size starts increasing from 40 years of age, bit by bit, 1 gram per year or 2 gram per year, in that frequency.
I see.
Okay. So once we reach the age of 45, 50 or more than 50, everybody will have got 90% people has got some sort of prostate issues, but they don't understand what is the issue. If we tell in a layman term, we see that while we are during childhood, we can compete with each other. How to throw our urine so long.
Yeah, that's true.
1 meter, 2 meter, you give pressure and urine is go. After you see 25 years, you reach 30 years, 30, 45, 40 years, and then the urine will not, you cannot propulse it to the long distance. It will bit by bit coming near to your feet.
Okay, that's because the prostate is getting widened.
That is the prostate is getting bigger, and it is compresses the water pipe. That means the urethra. In the male urethra, that is the water pipe, is 20 centimeter long. It connects the bladder, urinary bladder, and then the urethra comes through the penis. So 20 centimeter long urethra. And just at the junction of bladder and this water pipe, there lies a small organ, gland, that is called the prostate. And as I have already told, prostate is that is universal for all male persons. It just depends whether it is increasing or increased and giving symptoms or not. It is not a disease. Benign enlargement of the prostate, unless there is some other issues such cancer or something like that, benign enlargement of the prostate is similar to the graying of the hair. If we don't take any medicine for the graying of the hair, we should not start any medicine for the prostate also initially. So that is the first thing I must say to you, that once a patient comes, and we need to give the patient much time, around 10 to 15 minutes, to understand his problem. Not like I'm not sitting here to just prescribe initially the medicines. Because the medicines has got also some side effects, such as ejaculation problems, sex problems, and all these things. So first a patient comes with prostate problem, I need to ask how is your urine flow?
Okay.
Then how much you are worried about your urine issues. How many times the person needs to wake up at night to pass urine, and whether he has to give any pressure to pass his urine, and whether he can hold urine or immediately have to rush to urine.
Correct.
So if these are the irritative and obstructive symptoms, if the patient is having symptoms, then we will ask first, our attempt is to change his lifestyle. It first approach is the lifestyle modification, not the medicine.
Okay.
If a 50 or 55-year patient first comes with the prostate symptoms, all the symptoms which I have told you, then another question I have to ask, how is your bowel habit? Bowel habit.
Okay, right.
If he is constipated, then with constipation, the urine problems come automatically.
Okay, there are more chances.
If one thinks that I have a constipation problem, I pass stool every alternate day or after 2 days, and my urine will be okay with the medicine, that cannot happen.
I see. What?
Because first thing is to avoid constipation.
Okay.
So the first lifestyle modifications we need to tell to the patient, the first, whatever water you have to take during the daytime. After 6 p.m., reduce the water intake so that you don't have to go to the toilet much often, 3 or 4 times night. Otherwise the sleep will be disturbed.
Okay.
Second, after 6 or 7 p.m., reduce your caffeine intake. Caffeine means caffeine containing fluids, such as tea, coffee, fizzy drinks such as soda, all these things. So after 7 p.m., after 6 p.m., reduce. After taking the dinner, reduce your water intake, whatever water you take in the daytime, and avoid constipation. So these are the things which will reduce the symptoms 50%. Remember this, without any medicine. Because one thing we need to consider, if we start a medicine for a prostate to a patient, we need to continue that medicine's lifetime almost. So these are so if we delay the taking medicines for 3 or 4 years also, so we can avoid the complications or side effects of the medicines.
I see. So you're saying that if you don't, if you have prostate problem, if possible, don't take medicine at all.
Initially, we have to see the IPSS score and all these things.
And if it improves,
with
don't
lifestyle,
take it at all.
Don't take any medicine. And we ask the patient how you are feeling, that how is your flow, are you comfortable with it? If after changing the lifestyle he is comfortable what he is having now, why to start medicine? Then we see with uroflowmetry what is the flow rate. If the flow rate is very low, less than 10, patient is uncomfortable, his quality of life is affected, then we go for the medicine initially, not surgery. Remember this, not surgery straight away, medicine for 3 months, and then we see how much he is improved or how his quality of life is. We should not jump to the surgery straight away. And then after 3 weeks also, 3 months also, if he is having the same problem, medicine is not working, then only we'll suggest some surgical intervention.
Wow. So that means the prostate, once you start taking the medicines for it, it's for lifetime.
It's for lifetime.
And you cannot stop that anymore once you start taking. I want to know, like you said, it gets bigger and bigger when you have prostate problem, right? It gets bigger. But what is the actual function of a prostate?
It is a secondary sexual organ in our body. There is some primary and there are some secondary sexual organ. It's a secondary sexual organ. Primary sexual organs are our male genital organs and testes, and these are primary. Secondary is the prostate, seminal vesicles. So these are the secondary organs. So prostate acts as a secondary organ because prostatic fluid adds up to the semen amount.
Oh, I see.
30 to 40% of our seminal content is from the prostatic contribution. So prostate works as like that. Second, prostate also prevents the retrograde seminal ejaculation. That's a more medical term, which I say that when we perform sex, our semen comes from the front. It do not go behind to the bladder and mix with urine. It is due to the prostate. It is due to the prostate.
That's the function of it.
That is the function of it. And bladder, neck and prostate are very important.
So suppose just like some people remove tonsils forever. What if that is removed? Will it have any health impact on your
In
health?
fact, see, prostate for surgery, we need to very select group of patients. One thing I need to tell you, out of 100 prostate patients, 90 patients do not need any surgery. They are okay with the medicine.
I see.
Only 10% people need surgical intervention. So the number of people, there are many good medicines right now. And once we perform surgery, we cannot give the patient guarantee that this complication will not happen, because one complication is lifetime, that he will not pass semen again. It will be retrograde ejaculation. He will pass semen but in the urine, mixed with urine. So he will lose that sensation forever. Although his flow will be good. And secondly is that there are many complications of surgery, such as there is stricture long time or bladder neck stricture. But many people used to ask that whether I have done a prostate surgery, will it recur? Yes, there is a chance that in 10 years time, out of 100, 5 or 6 people or 10 people may have recurrence of the prostate.
So that means it's very less.
It's very less.
Wow. Okay. So yeah, it's very important part of our life, especially as a man, as a male. And without that, I think marriage can also, as a family, can also be affected if you're a young married man. So I think these are very important thing, and people need to understand this. But as you said, it gets worse and worse. As you grow older and older, right? As you grow in age, there is more chance of having a prostate problem. What causes it?
Now I'm coming to suppose we age after 45 or 50 years, there is a imbalance in our hormonal environment in our body. Testosterone reduces, estrogen increases in male also. So there is some hormonal imbalance. And the prostate has the growth pattern with aging. And again, I want to tell you that on the basis of ultrasound, we should not go for surgery. We do not perform ultrasound in a prostate patient to see the prostate size. It is a misconception. If a patient has got 100 gram of prostate or 80 gram of prostate, it does not mean that he needs surgery. We do ultrasound to see the post-void residual. That means after passing urine, how much urine he is keeping inside. He cannot pass. So that is an indirect indicator that his bladder is failing. So for that aspect, we perform ultrasound in a prostate.
For diagnosis.
Ultrasound is not done to see the size, because lots of people are coming from the village background, and we see that prostate is 80 gram, 100 gram, 120 gram. When we perform the uroflowmetry, the uroflowmetry is a test, we ask the patient to pee inside a bucket, and that measures the flow of urine per second. If the urine flow we see, if it is less than 10, then only we must treat. Prostate size does not matter.
So that depends on person to person as well. Wow. So now, how to avoid that? Like you have suggested some, like if you have problem and you can go home and change your lifestyle and it can help you. But since as a person you realize that you know that you have not had any problem of such yet, but you want to avoid such problems in your life. For a healthy person, how to avoid that in the future?
For a healthy person who don't have a prostate urine related problem, there is no way to contain the prostate size. It will grow on increasing.
On its own?
On its own. Just like graying or balding. We cannot prevent it. It comes with age. Some people have, some people less, some people more. But there is no medicine to reduce its size. There is one medicine in the market, that is dutasteride or finasteride. That's also, the captions are a little bit different. 25% reduction in 6 months time. And after that, we don't know how much it is reduced. And the ultrasound assessment of the prostate size is very, very erratic. Sometimes some people will say that 30 gram prostate. Some people will say that it is 40 gram prostate. So people has got a different conception that I have taken this medicine and the prostate has got reduced to this much of size. So this is a misconception, and lots of infodemics are there. There is a information bombardment, and people cannot take decision. So ideally speaking, only one medicine, that is alpha blocker, tamsulosin or silodosin, this type of medicines we are giving. And prostate size reducing medicines, these might reduce or might not reduce the prostate size, people are taking. But one must say that these have got some sexual side effects. So if a patient is very, very sexually active, we just avoid these prostate size reducing medicines. These are not so much of effective.
Okay.
Yeah.
So does it matter? Like you said, prostate problem comes with age, right? That is very, very clear. I think you find as the hair also gets gray, even prostate size also increases. That's part of a human body, which is understood. But is it the case for a person, for example, who abstains from all these sexual activities? If imagine that man has like very less sexual activities or not engaged at all because he's not married and so on, will it be this? Does the sexual activities determine the prostate problem also?
Yeah, my humble answer will be in this case, no. Sexual activity is good for your prostate and your overall health.
Oh, I see.
One must say.
Okay.
If a 60-year or 70-year or 80-year people is still performing in sex, and then he is having less chance of having heart ailments, his hormonal changes are very, very less, he is performing good because his testosterone level is running in a good level, he is avoiding the prostate problems.
Okay.
So all these things will improve with sex. So sex is a part and parcel of life. And if as you age, if you are good in performing sex, it is good for your overall health, not only for prostate. It is good for health.
Okay.
Yeah.
I think those are very important information. So that people should not, just assume and just regret or feel guilty about things that, maybe this is the problem that I'm facing, which actually is not an actual problem. Like some people say that it can be because of your sexual activities that prostate cancer, right? So what are the symptoms of prostate cancer? Like suppose.
Prostate cancer, in most of the time, people came as a benign enlargement. So the symptoms are same. That some person is having difficulty in passing urine, that more time he is going at night for peeing, and then his flow is reduced. So we assume that this patient is having benign enlargement. That means not prostate cancer.
Okay.
But in all cases, we do some tests, such as one ultrasound. One is PSA. PSA is a prostate specific antigen, blood test.
Correct. One blood
so
test.
if the blood test is more than 4, or digital examination or on ultrasound, if we see that there is some suspicious nodules in the prostate on examination, then we think that there might be something. PSA is more, prostate size is more, and there is some nodules in the prostate. Then only we will advise some MRI. MRI can pick it up, that if there is some abnormality in the prostate or not. Then if the MRI also positive, then we ask for guided biopsy, needle biopsy of the prostate, then we can detect. But one thing I need to tell you, as we age older, suppose 80, if we do the biopsy of prostate in 80 years of age people or 75 years age people, you see that 50% will have some sort of cancerous focus in the prostate. These are insignificant, and we should not treat them very seriously. So now there is a question of over treatment. Some people, everybody see now the Google or all these things, and there is a infodemics, as I have already told you, that the information, there is a bombardment, and we cannot, because all this Google and YouTube, this give us enough information, but not knowledge.
True.
To convert the information to a knowledge, we need some sort of expertise.
Expertise and experience.
So most people are now being treated with insignificant prostate cancer by radical prostatectomy, robotic prostatectomy, and all these things, which they don't deserve or don't need to do at that age. Otherwise, if you don't operate also, his lifetime or life expectancy will not reduce. So before treating surgically or by radiotherapy any prostate cancer, we must see what is his age, what is his comorbidities, whether he is moving about or not, and in the biopsy specimen, what is the grade of the prostate cancer. If the grade is low, the patient is in good health, no treatment at all.
Oh, okay.
So we need to understand all these things. This will prevent further over treatment by some unscrupulous institutions.
Okay.
So this will be very, very useful for those who cannot afford all these treatments, hi-fi treatments, and people also don't need also those type of treatments.
Wow. But what do you mean?
Suppose the patient from village coming in 80 years with a small amount of prostate in the
cancer
in the prostate, which is insignificant. Some Gleason grade 3+3 6 or 2+2 4. This type of patients don't need a cancer treatment.
Okay.
So we need to make them understand, talk to them, and make them understand that you do not need to spend so much of money for all these surgeries or focal therapy or radical prostatectomy or robotic.
Then how will it
surgery.
be treated? Those low grade.
This low grade will not grow.
It
will not grow.
What if it goes to third stage and fourth stage later on?
These are suppose a person is having a 55 years of age. He is having a prostate of having a high grade prostate on biopsy.
Okay.
This person needs treatment.
Yeah,
but if a same thing is happening in 85-year or 80-year-old people, he needs no treatment.
Okay.
So we must balance the treatment protocol according to the stage of the prostate cancer as well as the economic condition as well as the socio-economic side. Everything should be balanced in a way. Young age, high-grade prostate cancer, treatment, surgical treatment, robotic prostatectomy, laparoscopic or whatever you need.
I see.
If same prostate low grade in a aged people, no treatment is needed. No treatment is needed because that's will not change the life expectancy of that person. Why to unnecessarily do a surgical treatment on that person?
That's wonderful. Yeah. You know, I heard that like I mentioned, the former president of the United States, Joe Biden, he got diagnosed with 4th stage prostate cancer. And there was no news of 3rd stage also, directly 4th stage. Is that possible or
it's possible. It's possible. I'm telling. There are many things we don't expect that something will happen slow by slow because that prostate cancer do not happen overnight.
Yeah,
it comes many years.
Exactly.
It was detected, suppose I don't know the exact scenario, but it might have been detected many years back. And they got slowly growing. And after that, at this ripe old age, he is having a prostate cancer, which is full blown.
Correct.
And that is also not should be surgically treated. Wow. That is hormonally treated. We need some injections only. Okay. That's all.
Okay. Because he's like 77 or 78 years.
So at this stage, I don't think that he will need a surgical treatment.
Wow.
We need to see what is the grade of the prostate. If it is 4th grade, that means metastatic or something like that. No surgery is possible on this. We give only hormonal injections, hormonal therapy. That means cut the testosterone from the body. Testosterone comes from our balls. From the testis, and testosterone is the food for the prostate cancer.
Okay.
So we need to cut the food to the cancer so that the cancer will get treated.
Oh, that's wonderful.
So this is the concept.
Right. So in our normal day-to-day language, a man who has high testosterone, they have energy, they have like strength, and they can do a lot of work. Is that related to the one that you're talking about?
No, it is not related.
Okay.
Prostate cancer is more or less related to genetic.
Okay.
Yeah, it's if there is a familial history, then the father or somebody in the family tree is have a prostate cancer, 1st degree relatives, then there is a chance of prostate cancer is more. But it's nothing to do with the more testosterone or activity status.
Right. But can testosterone be like improved? Suppose people who have low testosterone, they're physically weak and they're lazy, they're not active physically. So can that be improved?
Temporarily, that can be improved, but temporarily. We must understand one thing, that we should not manipulate too much on the God's wish.
Okay.
If the God wish that a female gets menopause at 50 years of age, we should not give extra estrogen to keep her Yeah, otherwise some mishap may happen. Similarly, in a male person after 50 or 55, his testosterone will get reduced, his sexual drive will reduce a little bit. We have to accept this. If it is too much unacceptable, then on temporary basis we can give some hormonal treatments, but otherwise not. It is also called andropause. Such a similar thing is menopause in female. It is called andropause in male.
Okay. Yeah. Well, this has been very interesting, and I think we get to learn a lot of things. And people suppose who feel that they might have a prostate problem, then what would be the simplest and first easiest way to get it confirmed whether they have a prostate problem?
First, we need to do a uroflowmetry.
Okay.
Uroflowmetry.
And your center also does that?
Yeah. Everywhere it is done. It is done in Dimapur as well as in Kohima also. My colleagues are here. They can get it done. Uroflowmetry. See the flow.
Correct.
Not once, it is twice. Today and one after 1 week. See how is the urine flow. If the urine flow is 15 and above per second, then he is in a comfortable position. Second, we need to see that whether the patient has a constipation or not. If he has a constipation, get rid of that constipation. And third, do an ultrasound and see how much urine is inside after peeing. So whether he is holding urine or not. Second, treat the fourth thing is that treat comorbid diseases such as blood pressure and sugar. Sugar is another cause for prostate-like problems. Not prostate, but prostate-like problems. It may cause bladder don't pump in long-standing diabetes. So we must include all these things, get rid of all these things, and he will be okay before starting of any medicine.
Wonderful. So, and one last question is, some people, like you mentioned, people who go to loo to pass a stool, like just alternate days. There are people who don't go every single day. There are people who go morning, evening. So people who go alternate days, irregular, as very normally, does that affect the prostate problem also?
No, that will not affect. That is, you are talking about, I think it's usually happens in younger people.
Yeah.
More of younger, that is called irritable bowel syndrome.
Yes.
That is related to our brain.
Okay.
So in brain there are two types of signals, one for the stool, another for the urine. So that is called irritable bowel syndrome. Many people, they are very, very anxious. Type A personality. 35 years of age, very anxious people. Lot of tensions they used to bear in their brain from morning to evening time. So these people, type 1 personality, they have continuous rush of adrenaline in their blood. So they cause functional obstruction of the bladder neck. So they have a less urine flow. This is not prostate, that is called functional bladder neck obstruction in young male. And these are the people only who are having this irritable bowel syndrome. Because bowel is also, we should not think about both stool problem and urine problem in a different tissue. Both are same. Because just behind the bladder there is rectum. So everything is related to our mental status. If there is mental imbalance and we are anxious, we are all these things, type A personality. So irritable bowel syndrome as well as the urine problems both happens together.
Wow. So this information I think has been helpful personally to me also, to learn a lot and to keep in mind certain things so that, I don't have to face a lot of problems in life. I'm sure this will benefit a lot of our viewers. Suppose in case somebody wants to visit you because you have experience and expertise in this, and they can just visit your Guwahati Urology Center.
Guwahati Urology Center is in Christianbasti, first side of the Apollo Hospital.
They can call and make an appointment as well also? Yeah. Okay, sounds good. Thanks, Doctor, so much. This has been very helpful, and I wish you every best to help people who are suffering from all of this. Thank you so much.
Thanks.